about the strategy for the counteracting the stigma. This is this social stigma will be the very first portion of my presentation, and then the next presentation will be I will go to a little bit detail to the the previous lecture that Dr. Francis um, discussed in the early session. So we will discuss stigma in the very first beginning, and then we will expand what is social stigma in the second portion, and then we will a little bit differentiate what is stigma and what is discrimination, and then we will discuss how stigma affect our addiction client in their recovery pathway. Okay. If you have any questions or some, you can have a question directly on the the PowerPoint during my presentation, or you can discuss on the chat-in later. So, what is stigma? Stigma is uh, a kind of perception, or to be simple, it is a kind of a way of people thinking, people thoughts or perception that we stigmatize other person or a group of person. So we call it is a so stigma is a way of perception or thinking or thoughts of a group of person to other people, we can say. And then what is social? Social mean a group. So if social stigma is a severe social disapproval. Disapproval mean we are not agree with each other of this person characteristics or belief that are against cultural norms. What we call is a social stigma. So social stigma often leads to a stated laws, discrimination, and exclusion from meaningful participation in our society. So in this slide, you will see discrimination. So do you have any idea about what is stigma and discrimination is different from each other? Is anyone any idea about what is stigma and discrimination? As because I want to make a little bit clear about stigma and discrimination. Any idea or any any thoughts about the stigma and discrimination? Or do you think these two terms are the same? Hello? Hello? Hi, everyone. So do you think the stigma and discrimination is the same, or are they different? Do you have any idea about stigma and discrimination? So are they the same? Do you think are they the same, or stigma and discrimination is the same or different?
Yeah, it's
Any
the
idea
same.
or any comments about stigma? The same. So stigma and discrimination, so they are the same. The same. Okay. I think I need to be a little bit clear about they are not the same in in a very detail, but they are quite different because stigma is something, some kind of thought, but there is no action at all. For example, I will give you an example to be clear. Let's say um, for like a uh, factory owner or some some boss, uh, he think that SUD client are not trustworthy, not trustworthy. This is what we call he already stigmatized, or he has a thing, or he has a a kind of perception that the SUD client are not trustworthy. This is a kind of stigma. But in a sense of discrimination, because of his that the SUD client are not trustworthy, he doesn't hire this SUD client as his employee. It's a kind of just discrimination. So it's different, different. So discrimination is a kind of action based on the the perception or stigma. Stigma is that the SUD clients, even though they are in recovery state, they are not trustworthy. It's a stigma. Discrimination is he doesn't hire as his employee. It's a discrimination. So it's a little bit different. It's a little discrimination is a kind of action, a kind of action that makes that that based on his stigma, he do something to the client or someone. It's a called a discrimination. So you got it. So stigma and discrimination are a little bit different. And then so do you have any question about stigma and discrimination now? Are you clear? Or maybe you need a bit more example or something?
Um,
Okay. So shall we move to another slide?
sure, Ma.
Yeah. So you can see a discrimination is the exclusion from our mini that so a person who sees and also they are not social, they don't get any like enough social support from the community. So because we, especially in our culture, we easily stigmatize patient, like especially the addicted, our SUD client. We stigmatize them as the not efficient. So we already even like our like health workers in the rehabilitation centers, or like in the hospital, we already have a discriminative manner to our clients. So we need to be very careful about that, because the stigma or the discrimination can be indirectly proportionate to the recovery pathway. The more the person is stigmatized and discriminated, the less he will be recover in his recovery pathway. So we need to be very careful about that. Okay. So there are stigma study which is done in the the substance abuse and additions University of Nevada. There are 197 participants in this study, and they found out that they found the participant of the, there are that they have the questionnaires, and they found out that 60% of the SUD client, they feel that most of the people treat them very differently. They treat them not like a normal person. They are treated very differently. It's around 60%. And also surprisingly, 46% of the SUD client, they were afraid. They were afraid of. They were people afraid them. People afraid them because of they are using substance injecting drug. So they are being afraid. 46%. And also, even their own family members, they gave up. They gave up them our SUD client is 45%. Like we can say they are being neglected by their family members, or they they are just nothing by their family member is 45%. And also because of the discrimination, as I mentioned earlier, the employer paid them a lower wages is 40%. It's very sad. Even even they did the same duties, they did the same responsibility, but they are being paid lower than the average person is 40%. So this study is done in the University of Nevada for substance abuse. Okay. So shall we move to the next slide? So now we can very clearly see that the stigma is affect very, we can say, in a reverse proportion to the recovery rate, because the people is being stigmatized and being being discriminated. They feel very shame. They feel very they are very reluctant to seek a help from the help personnels, or like from the recovery support group. So negatively affect the recovery rates. So stigma, the stress of hiding an SUD either out of pain or to avoid stigmatizing response from others can cause other medical and social problems and make it harder to seek treatment. It's very clear, because they are being ashamed, or they are being discriminated, so they are being stigmatized, so they are very reluctant or delayed to seek the treatment. So what matters? We see, we in our rehab center or in our class, we sometimes say that we liberalize them, or the language we use is very important for them. The language usually we use it, the ethic, or they are not clean, or they are dirty, or they are junkie, they are user, they are abuser, or they are IDU. So even sometimes we need to be very cautious about what the language we use in our rehab, or in our own center, or in our hospital. The language we liberalize them by means of language. So we need to be very careful about what methods we use. See, okay. And clean, dirty, and so when we use the word clean, even clean means the word clean means the person is once dirty. So we need to be very cautious about the language we use. Clean means the person is being dirty in the past life. So we need to be very cautious about the clean and dirty also. So in by means of language, we usually put the people first, like the person with substance use disorder, or person with injecting drugs, or person with addiction is better than we use like junkie, or we use clean water. It's better that we use the person in the first place. So I think we will do it later for the stigma role play. So stigma can lead to self-fulfilling predictions that those who are addicted cannot recover or play positive and protective social roles. So stigma prevent that, even once he is drug user, because of we are, because we are using then the language, or we labelize them a dirty, clean junkie. So people of our client, they feel very shame. So they what they shame, or they fear, they cannot, or they are very reluctant to can our supportive group. And then they also feel that they are not never recovery. They feel like that they are not never recovery because we already stigmatize them. So when we stigma, I already explained it in the previous, we can lead to the discrimination. So example, employers, they're not wanting to hire anyone who is in recovery, even though he is in recovery. The boss, they are not wanting to hire any in recovery. So these can lead who are addicted to feel hopeless and reluctant to seek help again. Uh, so so this exercise we will do in later. Okay, and I go to the I think I will go to the my presentation as module 5, because we will do this stigma exercise on roleplay or in WhatsApp application. So we will go on the module 5. Module 5. Okay, wait for 1 minute. So in the meantime, do you have any questions or any about stigma and like discrimination? And do you have any idea about uh, um okay. Do you have any questions about stigma and discrimination? So do you have any questions about stigma and discrimination and also social stigma? Or shall we move to the module 5? So in module 5, we are going to discuss a little bit more detail about what Dr. Francis discussed in the morning session. So what are the characteristics of the psychoactive substance? What are the consequences of we discuss in the consequences of the substance abuse, and also we will discuss about how substance use and addiction affect our family. So in this module, we will learn at least 3 characteristics of the substance abuse, and we will discuss the individual, family, and community. What are the consequences of the substance abuse, and we will discuss substance abuse in our community, and we will discuss the effect of the drug use on the family. So, what is drug? A drug is any substance with the potent prevent or cure disease or potential to the enhance physical or mental well-being. It's well, drug is that affect our physical or mental well-being, or maybe we can cure the disease or the potential to feel good in our body. So we will learn what is right in the sense of medicine, in the pharmacology, and other treatment. In pharmacology, any chemical agent in the biochemical or physiological process of which can alter. So we can altering changes in our body by means of biochemical or physiological process. So in pharmacological term, this is the drug can alter in our body process is in the pharmacological term. In medical term, that can cure disease is a medical term. In pharmacological sense, that can change the physiological process or biological process in our body tissue. It's a drug. So in common uses, what is drug? Any kind of substance that is used for non-medical, for example, recreational reason, is called drug. We call it in a common uses, we call it drug. So we have a little bit description about stimulant, depressant, opiate, and hallucinogen in the early morning session. But in this session, we'll go a little bit, detail in what is stimulants, what is depressant, what is opioid, and what is hallucinogens. So stimulant, what do you mean by stimulant? A stimulant means that increase the activities of the CNS, central nervous system. Central nervous system, we have a slide on data problem. The CNS, central nervous system, contain our brain and our spinal cord. And depress means decrease. Stimulant is make it increase or make it feel good. Or depress is make it down, or we call it downer. Depressant or downer, the decreased activity of the central nervous system. And also opiates they decrease the activity of the central nervous system. And hallucinogen is quite different from the other 3 groups. The hallucinogens is not a depression up now or down now. It's kind of producing like a vivid sensory distortion and markedly alter our mood and thinking. So it changes our perception. Like for example, LSD is a hallucinogen. We can see the things or the thing that doesn't exist in our reality. Or maybe we like like sensory distortion is we can see the sound. It's called the sensory distortion. We cannot see the sound, but when we take hallucinogen we can see the sound. So it's called the hallucinogen. So we will discuss a little bit detail in this session about these four groups. And also other psychoactive systems, they are not neatly fit in the basic classes. It's like cannabis, myra, inhalants, and dissociative anesthesia. So we will discuss two main groups in this session. The very first is the four main groups, and the other we call it the other because we call it cannabis and inhalants. They are not very much fitted into the basic classes. So the basic classes and the other four groups. Exercise. So I think we will go to we will learn more if only we do this exercise by going to the resource pages. So in this exercise, we draw a human figure, and we by using words as possible, we indicate the route of administration. For example, heroin. So how many routes we can use for the heroin? We can smoke, we can snort, and we can have an injection, or we can have a intravenous injection. So what are there? And after we have studied the route of administration, we will study the effects, how heroin affects on our body. So and the other thing we will study about the side effect and what are the medical consequences of the drug. So mm, and also we will study about the what are the withdrawal symptoms.
Mouse weg. Break.
Break. Okay. So what are the consequences of drug use? So individual may suffer a range of consequences. Mainly there are four consequences in our life. Like the drug may affect medically. The second thing is the drug use can affect legally, and also socially, and also economically. So we will discuss on like exercise how drug use affect these four main areas. So different physiological response make drug use and drug response in different men and women. Compared with men, women tend to develop physical problem related to substance use sooner and escalate to addiction more quickly, which is we call it telescoping. Because in a study, we know that the body building structure is like women, they have more fats than men do. And also the water content in our body of men and women is different. So it can be different physiological response in between men and women. And also, much of the research on women has been regarding alcohol consumption. Newer research suggests that there is a similar pattern of rapid progression with illicit drugs. And also we need to be aware of that. Usually study are based on the male subject and not on the women. So this is a little bit different, or maybe sample side according to the sample side, we usually use male subject, and women are usually as a part of the research. So it can be a little bit um, it can be biased on the study of the male and female study. And a significant gap remain in the knowledge of physiological effects across the continent of the women life. So fetal effect. So affects fetal effects. We know that uh, drug can affect fetus through placenta. If the mother is smoke, if the mother is injecting drug, the effect of the drug can go to directly to the fetus through the placenta, through our bloodstream. uh, so even though the fetus is not using a drug, the fetus already addicted to heroin. Even he or she is even not in the in the tummy of the his or her mother. He already addicted to drug because of the the mother is smoking or the mother is injecting drug. So how it can affect? It can affect obviously the development of the behaviors and cognitive deficit. Cocaine, for example, cocaine and marijuana exposure can make impair attention, language, and learning skill and behavior problems. When the fetus is exposure to the methamphetamine exposure, is make the fetus grow very slowly. So the fetus is not grow in according to their weak size. So the fetus is the baby is very small, and the people baby is the baby or the fetus is very decrease in movement and alertness, so it decrease arousal and poor quality of movement in infants. So it is very sad that even though he is very innocent, in he already become addicted in his tummy, in mother's tummy. And heroin exposure, infant born addicted, low birth weight, an important risk factor for delayed development. All the a drug may make the baby delay development. So maybe he is not bright as other children do. He is like a dumb. He is not like like other children do. So what about the youth and adolescent? The earlier we use drug in very early life, the more serious drug abuse and addiction. So we need to be very cautious about adolescent and children group, because the, the very early the drug, the more addicted behavior, the more addictive behavior can occur in the, youth and adolescents. And young people also are particularly vulnerable to physical and social problems related to substance abuse. We can see here, very different images of brain development in healthy children and teens. See, they develop blue present maturity of brain areas. The blue area here, frontal cortex and the brain area, we can see they are blue area. So we will do a small group exercise in regarding with the 4 areas of the consequences of the drug use. The main 4 area is our family, our legal issue, our social or economic. So in regarding this 4 area, we will discuss how the drug directly affect the individual, and the second thing is how the drug affect the individual's family, friends, and co-worker in the significant others. So when we do a small a group exercise or in WhatsApp, we will discuss in the 4 area: legal, family, social, and economic, in regarding with direct effect, and we can say another is indirect effect of the drug. So drug use in the community. So we already know that in our community, even in our country, Myanmar, we have different community. So the type of drug use is different in each area of our country. Let's say in, like, northern Shan state and Kachin state, they are very common usage of heroin and other hard drug. But like in other southern country, or like in the middle country, the type of drug use is different. For example, like in our like the main city like Yangon and other nearby province, the drug use is not the drug of choice use is not a heroin. It's like a methamphetamine or some other. So it very different in our communities and our nearby community. The type of drug use is different. But drug use is common among all ages. Drug use is not limited to one socio-economic group. So it's very important to know that we are studying the drug use in the community. So the next assignment will be in drug use and demographic groups. Mean for your assigned group, the drug commonly used in your community and how they use, how the route of administration is. They are smoking. Are they smoking, or are they injecting, or are they like use intramuscularly, or are they snouting, or any other specific problem regarding with drug use? We will skip them. So I think family will be the next will be the next trainer, I think. Chisu, hello?
Please wait a moment. I will check.
Yeah,
Let me
yeah.
check. Yeah. In the agenda, Dr. Francis. It shows Dr. Francis.
Is he there, or shall we move on? Dr.
He's
Francis is here.
not. He's not here anymore, so maybe Amma we will start.
Oh, okay, okay.
Yeah,
Yes,
he's
yes.
not here anymore.
I'm sorry. From the final agenda, it seems like you are all the afternoon session. Is that right, Dr. Chisu? The final version is Dr. Niang is all session of
Yeah,
the
I think
afternoon.
I think my session is at the end of the consequences of the drug use, but I will move on. I can move on. Yeah, it's okay for me.
I don't know because we have the final draft that I saw from the master agenda this afternoon is you. So could you?
Oh, yeah. It's okay.
Thank you.
Yeah,
Thank you. Go ahead, please.
yeah. So the so we will expand our understanding about why families are important in the rules of substance abuse, or maybe in the rule in the rule of addiction recovery. So the elements of family is in a hierarchy. Hierarchy is like for example, in our culture, in our country, father is the most hierarchy in the family tree, you can say, and the parents. If there is a grandparent, the grandparents will be the top of the hierarchy, and then the parents and the children, and then the grandchildren. So that this is the hierarchy. We call it. And the rules is you know we call it in our culture, usually father earn for the family is a rule, and the mother is keep the house, keep the family togetherness is the rule, is a wife. The father, not the husband, is he is a leading rule of the family. Rules, the spoken and unspoken. Rules mean, for example, uh, our family is at 9 p.m. we must be at home. All of our siblings must be at home at least at 9 p.m. This is a spoken rule. Unspoken rule is like uh, we have to pay respect the elder. It's unspoken. We need to be understand, and we don't need to speak out. It's unspoken. This is rule. Like the pattern of behavior, we should be very for example, the elder need to be very care about the younger sibling, and he needs to look after the younger sibling. It's a pattern of behavior. Interlocking relationships. Interlocking relationships are kind of family cohesiveness in our relationship. Cohesiveness in our relationship. It's an element of the family. This is the element of the family. So what are the function of the family? So we will study the in this session we will study the elements, functions. So we know the elements. Elements are rules, roles, like the cohesiveness is the elements. What are the functions? We operate of love, care, respect, and concern, and we create and maintain order, and we seek the balance, family balancing. Family balancing is a skill to solve problems and make decisions, and also we everyone cooperate and work together. So it means we make a balance in our family. Otherwise, the balance is not no balance. Unbalanced family is not very much cohesive, so it will break. And also, we have a clear and noticeable boundaries. So, uh, especially in our culture, um, we need to be, follow the rules and regulation provided by our father. So we really, against our father, so the father should be um, very respectful in position. He needs to he needs to behave like a father. So orders of the the principal, father, he need to give an money or enough income for each of the family members. His duty is a noticeable boundary. So if there are not boundary, and if other are not in the family will break easily. So it is not a functional family. So it will lead to a dysfunctional family. So rules, standards, and guidelines are should be consistent. So yeah, we can notice that some of the uh, like the father, they make the guideline very much inconsistent. So let's say do as I say, but he doesn't do like a proper manner or proper proper thing. So this is not a very consistent guideline. So a consistent means, what is consistent? Consistent means what to expect. So he make a rule that everyone should be at home at 9 p.m. But he doesn't come back at 9 p.m. It's not a consistent rule. So the rule should be consistent. I mean, if he make a rule that everyone should be at home at 9 p.m., so he should be at home at least 9 p.m. So that the rule standard should be consistent at that point. And the adults are close and share authority and support each other. A single parent is confident and in charge. This is some family, they don't have two parents, so the only the one parent is both father and mother. So uh, only one parent should be confident and in charge. So members share feelings, negotiate, and disagree without fear of rejection or losing the relationship. So, and also member offer growth opportunity for others members. So they should give a place or a role to other family members or opportunity to other family members for the family cohesiveness and family growth. What are the dysfunctional families? Dysfunctional families do not acknowledge that problem exists. UD client, patient, client, they usually mother or father, they don't want to other people know that their son is addicted or their son has alcohol. That they always stop when people start talk about this problem. They usually make it stop. Do not talk about this problem. Our son is okay. Our son is not addicted. So this is, we call it dysfunctional family. Although there are many problems because of the drug addiction, they are not allowed to talk about this is a problems. And also uh, learn not to express emotional needs or to take care of need. So they try to adapt how to become a survivor. what we call. And so become detached and lose trust. So we the fish from we don't trust each other anymore, and also we lost our individual identity. Father lost his what we can, you know, more power than their parents because their parents trying to conceive their son problems and their son become more powerful because they are trying to conceive their problems. The mother lost their identity and also their father lost their identity. And development, especially for children and youth. And focus nearly all attention on members who is addicted. And also they try to conceive all the problems upon the addicted client, not other problems. So substance use disorder in family system. When a family member had a substance use disorder, the family system change because all of its elements and functions are affected. As we discussed, because substance abuse can affect the elements like rules, like functions. They can affect all the rules, functions. So when the substance abuse is in our family, the family system has changed. So what is the role is enabler, hero, scapegoat, mascot, and lost child? Okay, we will discuss a little bit enabler. Enabler is usually we can say in a mother. What we call if what is codependency? Codependency is although the son is only one substance abuse in a family, the whole family became like him. Dependence is what we call codependency rule. Codependency rule. Even though the father, mother, the sibling, they are not dependent to this system, they are become like the substance abuse in this family. What we call dependency rule. The first dependency role is enabler. We will discuss an enabler. Enabler is protect the person with addiction. So the enablers try to protect the person with addiction, make excuses, trying to keep anyone happy. Everything is fine here, underlying feeling of inadequacy or fear and helplessness. Okay. Let me give you example. Usually, this enabler is usually the mother of the substance abuse. Usually, she trying to make everyone happy that although his okay, let's say the family had three son or three siblings. One of the son is addicted, but the mother trying to conceive that this son is doing okay. So she makes many excuses that her son doesn't has a problem, so everything is going fine. But in her actual feeling is she feel very inadequate and she fear about that. Trying because she trying to conceive that her son is addicted. He fear that her husband will know that this son is using substance, and then because she doesn't tell or she doesn't talking about this problem, she feel very helpless. It's what we call enabler. Usually enabler are the mother of the family, usually because your mother, they want to make everyone happy in the family, so they trying to conceive the family the problem. They trying to make it not talk about these problems. So it makes very difficult for the although she is not using substance, she trying to cover up, she's trying to cover up the addiction problem. So we call it codependency enabler. So enabler is someone protect the person and try to make everyone happy. Everything is fine here, but her underlying feeling is not adequate, and fear and helplessness. And the hero is the one, he try to ignore the problems, try to ignore the problem. Even though there is a problem in the family, he try to ignore the problems, and he really trying to be successful to be go to help the family. But and the underlying feelings of fear and guilt and shame. And the hero, this is hero. He tried to ignore the problem. And scapegoat. Usually scapegoat, they rebel, they make noise, they divert attentions, and it's sometimes seen as a problems. But underlying the feeling of shame, guilt, and emptiness. Scapegoat. And mascot. Mascot is usually they are the entertainer. They divert attentions. They make inappropriate, sometimes hurtful jokes, underlying feeling of embarrassment, shame, and anger. It's we call it mascot. And lost child. A lost child is like is a very silent in the family members, and the lost child is careful not to make problems. So he or she is very silent. Yeah, she or he never complained about what is happened to her or him. He is very silent, and because the lost child underlying feeling is loneliness, he feel that he is being neglected, and anger is a lost child. So there are 5 codependency roles in the family. The first one is enabler. The second one is hero. The third one is what, mascot. The fourth is lost child. Uh, lost child. Scapegoat and lost child. There are 5 codependency roles in the families. So what happens to the family when substance use stop? Stress and loss of emotional security occurs from letting go of all roles and responsibility, no matter how destructive the role. And also uncertainty develops from loss of some familiar rules and behavior. And family members may have difficulty living joyfully despite loss or suffering. And also, although the whole family is not using a substance, only one of the family member is using substance, the whole family need help. So we cannot, leave behind we cannot treat only the, substance abuse client, only one, but we need to treat the whole family as a whole. It's a very important in our recovery pathway, because family as a whole is needed for the, very smooth recovery pathway. Okay, family. So do you have any questions about family? Hello? Family. Family.
Amma, I think we already finished today's agenda.
Uh, it is
I sent you the
family.
latest agenda via the WhatsApp. Ama.
From agenda. Okay, let me check the
Yes,
agenda.
could you see the master agenda, the final draft, the final agenda? I think your session is so quickly, but normally we will complete your session around 4 4:50 p.m. 4 p.m. So but you are so fastly finish your session that the reason why you jump to the family session of the Francis tomorrow. So let's take a break for 15 minutes and we will return to the main room. 15 minutes, please. We will talk.
Okay, so
Let me check the agenda again because maybe we return to previous session or your session for more understanding because it is very important session. Your session and my session is very important. So we need to return to our session. But for the family session, I think Dr. Francis will continue for tomorrow. May take a break for 15 minutes and we
okay,
will
so we
return
can
again.
take extra 15 minutes. Okay.
Yes, we will return around 2:30